So I'm going to open with a confession, and I'm going to blame it on Milton because he's the one that gave me the microphone. The confession is that I am not a telehealth expert. That actually is my telehealth secret. Doctor.com right now doesn't do a lot in telehealth, and I'm actually here to try to learn from you all. When they say expert panel, that means really like me asking you questions as experts in this space. You know, when where's the clicker? It's my second telehealth secret, is where do you find the clicker? I only have one joke. You know, Doctor.com has this unique view into patient behavior. As Milton alluded, we power a lot of the data that sits underneath consumer-facing destinations, both the traditional consumer-facing destinations, the Googles and Bings and Yelps of the world, as well as hundreds of doctor finders for hospitals, for payers, for pharmaceutical companies, for medical device. I've got a few slides here that show where we sit in the middle of all this. And as you think about the position that we sit in, we get this really rare and unique opportunity to observe the way patients behave. And by the way, our directories are very well lauded. They're very strong. We spend a lot of time figuring out how a patient is going to interact, what they're going to be looking for when they try to decide what care they're going to try to receive, and working really closely with the healthcare institutions who want to try to guide that patient through that care. And then there's these consumer-facing health destinations where we control a lot of the data that sits underneath what they're showing. And when I say the data, I'm really talking about what providers work where and what do they do. This is, to Milton's point, the patient who says, I need to go see a dermatologist. They're Googling dermatologist near me. They're seeing top 10 results. Almost all of them are this list of logos that you see. And we get a chance to observe what the patients are choosing, why they're choosing it, try to understand why they'd go to this dermatologist versus that dermatologist. And for us, when we think about what's special about that, it's that we have this opportunity to view from the patient's perspective healthcare challenges. And we think that telemedicine and telehealth are some of the ways that we can solve these challenges in a way which is broad and in a way which is going to be patient-driven and is going to be institutionally driven from people in this room, because it's going to start ground up from patients' understanding, and that's going to start top-down from institutions teaching consumers about why they should be using telehealth and what's important about telehealth. And what's interesting is we kind of look at the data that we get off of these behaviors. You know, doctors, hospitals are like, hey, we need to really make sure that we show what colleges our providers went to, our doctors went to. We really need to make sure that we show how many times they've done this procedure in the last 5 years. And then we look at the data, and it turns out a doctor is 5 times more likely to be clicked on if they have a picture. I think we overestimate the literacy of the patient that's out there and the literacy of the consumer that's making these decisions, and that we need to figure out great ways to get the information in front of the consumer, because the consumer is driving a series of health challenges that we've identified that we think can be solved by telehealth. And again, another telehealth secret, I don't have answers to any of these things. I'm hoping that you all do. And I'm hoping that this can serve as the beginning of a dialogue and the beginning of a conversation. Because as far as I can tell, I'm kind of the only kind of consumer-facing player in the space. Everybody else has a business model that isn't driven by trying to show patients things that they need kind of when they need them, no matter where they may go. You're all trying to actually figure out the business, the underlying business of health. So the things that we see, obviously the cost of care is insane, and it's obvious that telehealth can address that. We see physician burnout as one of the most important things we understand. We work with hundreds of hospitals and health systems. And the one little tiny window into physician burnout that we get is, if anybody is a doctor here or works at a hospital, when you Google your own name and you find either reviews from patients that aren't real, or you find a bad phone number or bad address that points to an old institution you used to work at, you call your marketing director, and that marketing director goes crazy and calls me. So they get so upset by the tiniest things, and we think it's because they're not given the opportunity to really facilitate what they were intending to do when they got into medicine, and we think telehealth can help solve for that in a lot of ways. Then there's just the poor patient experiences. You know, when people, regular consumers, look at the healthcare ecosystem, they report things like, you know, they have less faith in healthcare than they do in sometimes Congress, which is like embarrassing. So one of the challenges that they see, one of the poorest experiences, is these full specialist schedules. You know, you're trying to see a rheumatologist, it's going to take you like 6 months. You need to see a behavioral health specialist, you can make 30 phone calls before you can find someone who's accepting new patients. We think telehealth can solve that. And then, and this is really the driver here, and this is the, you know, the actual secret I'm going to show, is that telehealth can solve for patients that just have limited choices. And the fact that as they go from one institution to the next, there's no continuity. We see telehealth as having the ability to solve all of this. And it's because we see this concept of proximity as this kind of tyrant underneath all of doctor search. So I see what probably amounts to 200 million doctor searches every month. So obviously not 200 million patients, it's 200 million doctor searches. And across all of them, proximity is actually the primary factor. You may think they were looking for a dermatologist. No, they're looking for a dermatologist near me. It's so underpinning to the experience that they're having that you don't even think about it. Like, health grades can't even show you a listing that isn't near me. Everything has a radius concept. And so right now, proximity is acting as this tyrant that's limiting patient search, and it's limiting the sort of provider exposure. So see, 100% of searches are using proximity as the primary. It's using specialty as a secondary. It's using procedural expertise as a secondary. It's using languages spoken, gender, where they went to school. All those things are secondary to, is the person within 10 miles? And we see that as being this bottleneck, this horrible limiting factor. And we see it as putting this undue stress on these local health systems. Anybody who works for a health system knows it's hard to recruit physicians to go and work in some of these healthcare deserts. Anybody who works for an insurance company knows you're trying to get the coverage maps, make sure you get like that contract with that last cardiologist in this one rural area. And that we have this opportunity to alleviate these systemic challenges. As we did a little bit of basic research and had some basic conversations, it kind of looks like 90% of visits that are happening physically could happen virtually. And what does that mean? What percentage of like office wait times could we reduce to next appointment wait times could we reduce? And what can we do to increase the visit duration if we can reduce those wait times? Because that becomes a really important part of how the system operates. You've heard it said multiple times. In the 19th century, you got to spend 2 hours with your doctor because they had to walk to your house. And that if we can find a way to alleviate some of these systemic issues, you can actually let the doctor do what they trained to do, and we can get out of the way as technologists and business people. And so we're thinking like the patients could select anyone in the whole state. They can choose, the providers can see them more efficiently. You know, you don't have to wait for the person to come in and out. You can just sit at your desk and see multiple patients in a row if it's that period of your schedule. And we see that as having the opportunity to reduce burnout dramatically. And that we think that the patient data will just naturally flow through those telehealth systems. Because they're digital by their very nature. It's not like they need to be converted from paper. We see the telehealth systems as being inherently connected to the EHRs, to being inherently connected to the practice management, as being inherently connected to each other. And so we can try to achieve this data continuity that legalistically we haven't been able to achieve through interoperability standards and requirements. But telehealth faces these significant adoption challenges. And because this is a dialogue, people start yelling out adoption challenges. You know, why are patients having a hard time figuring out that telehealth is an option? Is it because they've never heard of it before? Is it because they have low healthcare literacy? Is it because? This is the conversation that I think is most important. As a business that thinks about consumers and faces consumers, we need to figure out how to achieve something that defeats these adoption challenges. Right? Because while these virtual visits are on the rise, and you look at these crazy charts where it's going insane, it's actually the N is pretty small if you think about the total number of visits that are happening every year. It's like hundreds of thousands of telehealth visits. There's like 800 million physical in-person visits every year. We're like not even scratching the surface. Telehealth is like a rounding error right now. And those of us in the room have the opportunity to try to address this, have the opportunity to try to figure it out. So how do we address these? And The answer is that I don't have an answer, and that all of us have this answer. Like, we need to sit down and think systematically about how we get in front of the patient when they're making the decisions. And the offer here, I guess maybe the reason why I'm here, is because I want to try to be the way that we facilitate this getting out into the doctor finders. Again, I work with hundreds of hospitals, work with payers and pharma and all these consumer-facing brands. Help me try to figure out how to move the needle, and we can work together to make this work. And I've got slides I'm just going to skip through so you can just see it go. And so I'm working with VSee, and we're going to try to figure out how to do this, and everyone else in the room is welcome to join us. So thank you. I'm not sure if I get questions or not. Oh, I do. No one should give me a microphone. This is a bad idea.
Is this on? Yeah, adoption is on both ends, though, right? It's not the patient, it's the physician. And the fact that the summary of the rules and regulations for the country on telehealth is, if you got 500 pages of reading time, you can read all 50 states' rules. And, you know, mental health parity, though it's growing, laws, and what I love about this conference is everybody has a different opinion. You know, the biggest blocker to the mental health parity, where commercial plans have to have parity with Medicaid, health plans, the lobby. I mean, it's so the adoption is where I'm at right now as well, on getting the doctors to understand how to adopt appropriately.
Yeah, no, I completely agree. One of the things I think is interesting about telehealth, though, is you only need a small percentage of the doctors in the whole state to address the whole state because of the licensure component. And that right now, if you can convince 80% of the patients that it matters, the doctors will follow. And you only need this many to get started.
Go up there.
I'll put this down so I don't steal it.
Thank you, and I think the work that you're doing is wonderful. My question has to do with what lies ahead in the way that we rate physicians. And so we have age caps in the hospital, we have caps for the physicians, and we're still seeing that the experience in itself, particularly for telehealth, is not accurately being measured, that telehealth experience is not accurately being measured. What do you see, because I know you guys get a lot of reviews, is what do you see if you look in the crystal ball as far as how will we be rating our physicians, and how can we get ahead of it?
It's a great question. That's actually one of the first projects that we're talking with VSee about. So in a way which is not an advertisement, Doctor.com has a patient feedback platform that providers of all shapes and sizes use to collect just more information from their patients. And we're embedding this across a whole series of experiences. And VSee, I think, is going to be our first opportunity to embed this into the immediate post-visit conversation with the patient, to start collecting and ascertaining some of that feedback in a way which I can then syndicate out in the web for other patients to make decisions. But yeah, I think there's just going to be more and more reviews everywhere. There's been some concerted lobbying efforts to try to make it so the CG and H caps are no longer required to be paper. Well, the H cap is required to be paper, but the CG cap isn't required. And so trying to sort of flip those two, make it so you can do the H cap digitally, make it so the CG cap can have some reimbursement, and we can just try to create so much more feedback that you actually might be able to make something rich from it.
Yes, thank you. I saw Google up there. I was wondering if you had any insights on how the Google search and their algorithm, how they choose to show their providers, and if they're making changes as technology goes along, say with telemedicine, proximity, and everything else.
So Google is obviously a black box, and I'm
Right.
not John Mueller. You can
I
you can
don't know.
text you can text
Yeah.
at him, and he will probably answer you on Twitter. So what we have seen is GMB is hugely important. That sort of Google My Business that was built for pizza places and salons has become one of the primary drivers of patients doing research. And Google has really struggled to understand how to represent a person who works in 3 places, and has really struggled to figure out how to bring healthcare-specific information into that environment. We have found that claiming, owning, maximizing those GMB listings is a great way to enhance the credibility of the provider themselves. And there's a tag called same as that you can go stick on a provider's listings all around the web, that if you claim the GMB and you stick that same as tag everywhere, Google's like, oh, I know who this is. And they're just confident, and then they'll raise all of those same as tagged pages in the rankings.
So that same S tag could help if you have, say, an office in different states, right?
Yes.
Just to give them.
Absolutely, because they're just trying to confidently organize the world's data and get it in front of everybody. So anything you can do to teach the robot what is actually happening on the pages is just going to inherently benefit your SEO strategies.
Right. Thank you.
Yeah.
Last question. There.
Hi, I'm the guy sitting in front of you with a microphone. And
Hi.
you've got a microphone. It's kind of weird.
Very weird.
So you described Dr.com as a consumer-facing app, right? Or sort of. I'm just curious how Dr.com interacts with the consumers today.
So it's interesting. So we interact through consumers through basically two main channels. One is, if you look at all those like real true consumer-facing brands, Vitals, Healthgrades, WebMD, Google, Bing, we power the data that sits underneath them. When you search for a doctor, how does Google know where that person works, where they went to school? I'm that data, and then I get back insights. How many times the page was viewed, where it shows in SERP, the click-throughs, how many people click the phone number, that sort of thing. And so I get sort of inherent tracking data back from those consumer-facing partners, and then I actually build hundreds of doctor finders for hospitals and health systems, for payers and pharma, and I actually am seeing the entirety of the exchange with the patient in that case. And in those ones, our expertise is involved in actually building the experience, and then I get all the data itself.
But the consumer really doesn't know you.
No, it's actually kind of amazing. We have this like ridiculous consumer-facing brand that consumers never see. It's pretty funny.
Thank you so much for the awesome
Thank you for the
talk.
opportunity.